Hello and welcome to Meet Your Inspiration podcast with Meri and Rich. Here we're talking about inspiration, motivation and empowerment. Our guests are ordinary people who became extraordinary, and with sharing their stories, we want to empower you to become the person you want to be and to go beyond your dreams.
Today, our special guest is Nina Balachander. Nina is a specialist on healthcare insurance, and we have a great privilege to be able to share your story and how you've developed to where you are today.
Oh,
welcome.
Thank you. Not done anything like this before, so
and
I'm sure everyone says that to you as well.
They do.
You are on the right place,
Yeah.
trust me, in the good hands. Appreciate that you came here and you're ready to join us. Quick intro. I met you two women in business, isn't it?
Yes, Women
For
Business Network.
one or another reason, we've been on the same table.
Yes.
So, yes, this is how we met. Few chats because we've been interested by your products, really pleased with all your service and how you deal with that. It was just incredible. And now we are happy to hear more about you.
Little me.
Yes. We like to take our guests back in the time and just to see what did you decide to do after your secondary school? What?
Gosh, yeah.
It wasn't that long time ago.
No,
Come on.
but I just, these days, many of us in business probably when you left, say, secondary school or university, there's a lot of people that haven't done what they set out to, what they planned.
This is why we
Nearly
love
everybody, which is why this is such
This
a
is
cool.
why I love this question, because
I do have people in my family that actually studied something and then just stuck with it for years and years. I wasn't one of those people. I don't think I ever knew what I wanted to do. I remember my mum sitting down with me with the UCAS book that probably, it's probably online now. There probably isn't a big sort of wedge of something that you go through. But I became a dietitian. I studied nutrition and dietetics at university. Became a dietitian for a year. It was nice. Worked in a hospital.
Were you interested in food and sort of that?
Yeah,
is that
nutrition
why
and food.
Yeah.
And don't get me wrong, it's absolutely fascinating, that link between nutrition and health and different disease states. And, and again, it affects all of us, doesn't it? How we look after ourselves. I mean, fast forward on to what I do now, I never thought there would be sort of that link, when you look back and think, is this all part of my journey or path or whatever? But I really like being a student, and I guess I knew mum and dad wouldn't say no to me going back to university. So I worked for a year. It was very interesting working in a hospital, but I think...
Where did you do your studies?
So I was at King's College University,
London.
In London. So worked, studied. It's a 4-year course. It's it's one of the more perhaps intensive ones. I mean, like I say, it's 4 years. There's a whole, I don't know if it might have changed now, but a year's work of placements actually going out there. So a year of 1 year of the 4 is spent actually working in hospitals, experiencing hospital kitchen life from the catering side to what the patients experience, that whole nutritional journey, if you like. And I think all the theory behind it's fascinating. And then when I was there in the hospital, I thought, it's just got to be more. So I went back and did a master's and ended up then after that becoming a senior research fellow for NICE that writes guidelines for the NHS. Again, couldn't really have planned this, given what I'm doing now.
Yeah.
So did you do the Masters at King's as well?
I did the Masters at the London School of Hygiene and Tropical Medicine.
Wow, okay.
That probably, I just had a great time doing the Masters. Thought I was going to go down the route of, at one point I was thinking of a PhD, but I'd already met my husband by this point, and then he proposed, which was lovely. I was then due to go out to Zambia and do a research project on HIV out there.
Okay.
And I guess from that point that he proposed, I guess my heart wasn't really in it. Well, I did, but I shortened it. But I was trying to collect data for my research project for my final master's degree.
Why did you choose Zambia? Was that just an opportunity to go there?
I think sort of the data we were collecting, gosh, it would all have been from a sort of public health, from a nutrition point of view still. I was collecting body metrics data and studying people with HIV and sort of learning a lot more about that. God, you're really making my cogs turn in my head as I recall some of this and what I did when I was out there. But I was working in I was in a clinic collecting data, sort of seeing how the clinic ran.
Had you travelled overseas before, or even been to Africa before?
I'd never been to Africa before. I had the opportunity to go to Arizona before and work again collecting research. I can't remember what that was for. That's terrible. But I had travelled before, but again, not much, not really. Sort of had the experience of seeing some really beautiful places, if I'm honest, just as a teenager. And then,
of course.
I guess more as a young adult for, you know, I mean, we're talking about small stints, you know, a few months at a time sort of thing.
And did you go with the group? So going back to Zambia. So when you went to Zambia, obviously, I mean, that
was on my own.
So that's quite a thing, isn't it? I mean,
quite a thing.
Yeah, you're going to like a part of the world which you don't know.
No.
It's eye-opening in terms of...
It really was.
Being so different.
Yes, and actually being a female in a country where everybody was telling me, I was very safe when I was there, but everyone was saying to me, you've got to be really careful. You've got to be really, really careful. Do not travel after dark. Do not go anywhere by yourself. And I think it's all good advice, but at the same time, when you're there and you have to live it, you're already got the seeds planted to make you nervous. So we went out there.
So did you get a nice welcome and well looked after when you were there? How did you find it?
Essentially I did. I'm really conscious about what I say. I don't want to offend anybody.
No.
It's a very religious country.
Okay.
When I went out there, I think people that did take me under their wing were also perhaps trying to convert me to Christianity. That I found, because I was there ultimately to I guess, learn, collect my data, do my research. And that was the side of it that, I sort of found a little bit tricky. I'm here to learn, but then there seems to be sort of a different agenda of why perhaps you're looking after me so much. And I know back home I would phone up my parents to say, oh yeah, so-and-so's, I've met a professor who's a lovely, lovely guy. And he actually was more about the research side of things. He was actually a professor from America. My parents were like, who? What? You're early 20s in a country that we're not really happy you're in, and you're going out with what man? So, I just remember thinking, no, you have to trust people. You do have to trust people.
Do. Yeah. And
you can't just lock yourself in a room.
They do take people under their wing, don't they? Help and support and guide people.
Sometimes do, sometimes not, but obviously it was experience.
It was experience, He was a lovely guy. And it's funny because everybody, when I walked around, when I went to the supermarket, clocked sort of me, I'm Indian, I have a very English accent, and they were like, oh, but she's not. Oh, where's she from? And I could hear them talking, and I picked up a couple of words, Chizingu and Mazungu. I think I'm probably saying them wrong. But I would hear these words of, I think ultimately it meant, but she's an English speaking, she's in, like, where, who is this woman? Where is she from? And she's not one of us, but in a nice way. But I met some absolutely amazing people. So a lady that dedicated, her husband, unfortunately, had not been faithful to her. And she had contracted HIV through him. He had then passed away. None of their children had it. And she had dedicated then her life to taking in children with HIV. And so essentially made her house into an orphanage, just gave them essentially everything she sort of didn't have, because she just, but then she'd set up a school to, she'd just taken all the children under her wing. Her own flesh and blood children had taken these children under their wing.
So Nina, obviously we always think of like in the UK when, HIV was a big thing around sort of the late 80s, early 90s. But HIV obviously is still a big issue in parts of the world still.
Yeah.
So was in Africa, I guess it was probably even more prevalent than it is here?
I think it's the education and getting the right retroviral drugs out there. I think the education was really key. I mean, we are now still going back, this makes me feel old, sort of over 20 years now for when I went out there, and things have probably changed so much. And people that unfortunately have to live with HIV, I think that's managed, the medication and the drugs are so much more available than, say, they first were. For these children, getting them the right treatment, but also it was all about sort of the quality of life, I guess, and the education, schooling for them. But the education of what I witnessed was, say, parents thinking the children are evil because they've got this. So there was abuse, which is why some of these children had then were seeking, so we'd come to the orphanage seeking care, needing help, because it just wasn't the understanding.
And I guess there would be loads of children that would end up with no parents at all at that point.
Yeah,
wow.
So, very sad, but the most amazing, it's one of those that no matter what goes on in life, you meet a group of children that are just so unbelievably happy, just gorgeous. Really, really amazing kids.
Wow.
Obviously, it was a good experience for you in a professional and personal
I mean, I think
life.
everything I went out there to do, as I say, the research and the collecting data, the bit I always remember was Jeannie Malinga, and the kids and the amazing work she's still doing. Yeah.
And what's happened with life here then?
Well, I guess I came back, got married, which was all good. What did I do after that? So I was a research fellow for a number of years. Essentially, my kids came along, and I didn't like commuting into London and leaving them. Was great. Had a really lovely, flexible job with NICE. And I do really believe in NICE guidance, and the work the NHS do, always have. Think it's brilliant, and think we're very lucky that we've got those sort of systems in place, the policies and procedures in place for that kind of treatment that is readily available to everybody. My kids came along, so then I did a bit of wraparound childcare from home.
Okay.
Yeah.
So I looked after children at the same school as my own kids. People dropped their kids off to my house.
But that's like that became a bit like a business.
I guess I didn't essentially see it as a business, but it ticks.
I did quite of regulations, thanks to the policies to tick,
had to get some qualifications for it, all the DBS, all the
this is what I mean. That is not just you look after kids. You need to go through all this, which is another level, and it's taking you to
lots of boxes to tick. Everything from what do I call it? DBS, criminal records check.
Nowadays it's safeguarding. There's all safeguarding stuff, isn't it? It's like all that legislation.
First aid, everything. Is just nuts. Yeah, but so that
from a favour to a.
But they'd come. The house was so lively. It's funny because now that my kids are a little bit older, I don't do that anymore. I've got a whole room in my house that's so quiet and barely used, and there was always people little people milling around. Back door would be open on a day like this where the weather's gorgeous and kids just in and out, but people drop their children off to me, give them all breakfast, which is what I'm doing anyway, and then we'd all walk to school. Really fortunate that the schools will walk away, and then I'd pick them all up. They'd do all their homework, and it was great. Actually, there was no television. I was so organised as well with dinners because it was all planned because I had to cook for all these kids. But we ate so well. It's like we won't talk about how we eat now, but we
will be
so organised. It was it's really lovely. And then I became a play therapist. I guess I had that chunk of time during the day. I had this amazing, beautiful dog that's so calm, that's grown up with children. So she became my therapy dog. So she got me into volunteering at schools, and I did volunteer in a nursing home for a bit with her as well. But I just felt like I needed more I could see that there was.
So what did that involve? So as a play therapist, what does that involve?
A bit more training, because I just seem to really like studying, it seems. But basically supporting children through, rather than a talking therapy, through play, and how they play and what they do. You're watching the signs and body language, and of course they will talk as well, but everything from through their drawings or music, or you've got a world of toys around you. I mean, essentially all of us are doing this every day with children when you're just playing with them. But yeah, helping them through play is again fascinating, very also heartbreaking. You've got children from those that are really shy, and anxious just because that's their nature, to some that have unfortunately seen or witnessed horrific things. And you're just trying to help them.
And I guess having the dog as well is also a great interaction. Again, builds confidence with them with animals as well, which is also nice.
And I guess a thing to be sort of wary of, because you've always got to be aware that people sort of mistreat things like this, but they would trust me because of her, or they felt comfortable to talk to her if, because I'm a stranger. But she, and I've had to teach my own children that not all dogs are like this, because this is a dog that doesn't bark, that doesn't, and when they were little and they'd see a barking dog, what's wrong with that? And I'm like, that's actually a normal dog, running around, barking, doing dog-like things. So she's amazing. I mean, she, bless her, has been poked in every orifice.
Wow.
And just sat there and looked at me like, really?
What breed of dog?
She's a Labrador.
What do you expect?
What
do you expect to be?
Very, very chilled. But yeah, amazing.
Escape to luxury at Hempstead House Hotel and Spa, an elegant country house hotel in Bapchild, near Sittingbourne, Kent. Relax with indulgent spa treatments. Dine in style with exquisite cuisine. Perfect for getaways, weddings and events. Experience luxury in the heart of Kent. Book your stay today.
Be the first to discover Kent's best events all in one free app. What's On in Kent is a new and rapidly growing app where you can find days out information, places to eat, festivals, concerts, markets, and much more around you. Just with few clicks on your phone or computer, you can stay updated with real-time info and explore events across Kent. Don't even think twice. Just download. It's free.
After the playing therapist, what came?
Well, I worked in schools, and that was becoming a little bit harder. So many budget cuts, and it got to the point, and I wasn't necessarily, I guess I quite like being kept busy. So the work I was doing, yes, it was great. Obviously, I was, getting a bit of an income, and it was sort of, you've got a mortgage to pay, you've got bills to pay. So all of that was great, but genuinely loved what I did, from the childminding. I didn't necessarily
Nina, just asking, what age were the children? Did it cover a lot of age?
So I ended up sort of, I saw all of my kids essentially with the childminding, saw all of the kids through from reception to secondary school. Okay. So once they had all sort of started filtering through, and I was doing my play therapy, and the play therapy, it depends if they've got what their educational needs might be as well. But essentially, again, from reception up until the end of primary school, so 11 to 12. But you can see children that are slightly older. It sort of depends. And also, I guess most play therapists would never want to sort of stretch themselves too much, see any children that they, didn't necessarily feel equipped to see. So you would always sort of gauge it on a sort of case by case, I guess. But I'd seen all of my children through primary school, and my kids were now sort of a little bit older and in secondary school themselves. So I thought that seemed to be coming to sort of a final close. And the play therapy that I was doing with the budget cuts in schools, there would be times when I wouldn't know if they'd need me still after half term. And so that was building... Insecurity. Yeah, real insecurity. And like I say, I really enjoyed what I did. And so the childminding definitely, it was sort of a little business, but it was also, I was home, I was doing it for my own kids, and it was fun, and we all benefited so much in so many different ways. the play therapy was growing, and I would have liked to have continued that. So I gave up working, and boom, actually, I think, and I was what do you call it when you're sort of failure of your own success, not failure of your own success, but
you go beyond it.
I'd flown so much, and I was working across 4 different schools, like pretty much full time. Like I'd done really well. I was sort of clocking up hours. I was thinking, right, I could work towards my accreditation, and I could do this, and I could become a supervisor, and blah, blah, blah. You know, everything's going really well. I'd like to supervise others and continue sort of helping people. And then boom, it's like, we don't have the budget. And all 3 or 4 of my schools said, yeah, sorry about that, but we've got no money to keep you on. And I was like, whoa. Okay, now I feel stressed, and would like, you know.
And that's a great shame as well, isn't it? Because obviously there was a need. There was clearly a need, and that's why it was introduced in the whole idea.
Yeah.
And then they just sort of wipe it out, and it's another.
And the need is still there.
Yeah, I'm sure it is. Yeah, absolutely.
And actually, the need, you know,
it's probably getting greater. Probably even more today than it was
post COVID. I mean, the impact on our kids was just phenomenal. I don't think you see it. I think you see it a lot if you're sort of in schools and in those environments, but yeah, it's phenomenal. And the need is 100% still there, but it wasn't just, say, play therapists and counsellors. It was dyslexia specialists, speech and language, budget cuts everywhere, with schools saying, well, we'll do the training ourselves in-house. And but if you don't have that skill set, how can you do that training in-house? I mean, you know, don't get me wrong, I don't want to. I think that, you know, there are amazing teachers out there that dedicate
fault as well.
It's just, it is what it is. So I started working for a foster organisation, and I guess really in a nutshell, I couldn't hack it. It was too hard. It was too hard.
I'm finding that very hard.
But actually, if I can say this, I won't mention any names. It was the staff, the conflict with staff. So the children have really high needs and are very demanding, and you've really got to take care of yourself when sort of being in those environments. But then the staff were so hard to work with, so hard. So that was something I hadn't ever experienced, because there be challenges, you know, and I think some challenges are helpful, whether it's in a sort of hospital environment and you're having a good debate about the sort of next steps for a patient, or whether you're in a school environment and you're thrashing things out with a teacher and sort of having those debates about, you know, the best thing for a child. Those are sort of really healthy, but this was sort of something different. So and I think it got to a point where I thought, I don't like giving up, and I've stuck things through, and, you know, things have come maybe to a natural end, or, you know, beyond my control. I've never given up on anything. So I didn't want to give up on children who had a lifetime of people giving up on them. I just couldn't do it, and for my own sort of sanity. And by that point, I'd already started looking at something else to take over. You know, if the childminding was coming to a nice natural end, and the play therapy, you know, I've got the foster care work, maybe I could do that alongside something else. And then boom, that's where WPA came in. But
out of nowhere,
I think someone had mentioned it to my husband. We're customers of WPA anyway. And so when we realised how it all worked, my husband actually came and said, someone's mentioned this to me as something I could do, but I think you could do this. And then I looked into it, and then, well, here we are. So
how long now you are with WPA?
Just a couple of years. It's flown by. It's going really well. Yeah, lovely. It's been a hard week, actually. It's been some challenging conversations and tricky things this week.
So obviously all this journey until now, you've been, obviously we know you love to study, as well you're showing that dedication in whatever you do, and you're always up to it to do it as best as possible but obviously all this because more or less you were your own boss all the time. How did you find that in general? What kind of support you had all the time? Because as everybody is saying, this is quite a lonely thing as well to do it in terms. I know the kids were bringing you the joy and happiness, but you've got all the organizational bits and pieces, and as we talk about the policies and all the bit boring stuff behind. Did you have people around you who were that support, pushing you, go and do what you feel is right, and etc. Or it was just yourself.
Sometimes it can feel like that, can't it? Just yourself. So ultimately, yes, with a lot of stuff, as a play therapist, I think that was probably definitely had that feeling. It was just myself, but did have a supervisor. So you'll always have, same for counsellors and all the therapies, I guess, you will have a supervisor to make sure also that you're doing things correctly. You know, you're doing the right thing by the child in front of you. But of course, they can't come with you and see and monitor what you're doing with a child. That would be inappropriate. So you verbally take the child to them, you know, without disclosing any information, but you're getting advice all the time, checking you're doing the right things, checking your own feelings as well, which is really important. So that supervision is crucial. With the childminders, I guess the type of person I am would always reach out, you know, I guess always been about collaboration. So I just reach out to all the other childminders and say, right, do you fancy having a coffee every now and again?
So you weren't worried, or you didn't find as competition or whatever? You were
I mean, I was as full as I wanted to be. There was a point when I thought, could I grow this and get somebody else to manage it? But I guess there's always been, I don't know, maybe I think I'm a trusting person, but I do have this fear of taking on someone not going to do the same as you. You know, you wake up one day and you don't feel very well. I still got to get all these kids to school. So unless I've got something really infectious, I've still got to get all these kids to school. I still got to, you know, cook for them and look after them and everything else. So do I trust someone to, you know, because I take on more children and I have somebody then that, you know, does phone in sick. I mean, I don't want to walk all that many children to school, as in from a safety point of view. I mean, I used to be that childminder. God, they hated me, some of them. I mean, they didn't really, but they hated the fact that I'd make them wear a high visibility.
When they're going walking along
on the way to school. I think, and again, no intentional harm sort of meant, but when COVID came along, because we had to sort of wash everything and, you know, we were isolating, I could still work because I had families that were in the police force and families that were teachers, and so I could still work. But that sort of cross-contamination meant that I got rid of the high-vis. I think all the kids were really happy. They didn't have to wear them. But I swear, I always used to say to them that everyone gives us way when we're crossing the road. It's so much safer because they see you from a mile off. So, from sort of not lonely, but those jobs that I did, definitely I was more on my own. Whereas, I mean, there are times when I feel like I phone WPA sort of maybe every hour. I've just got another query. But they're always on hand. And the biggest support, I have to mention my buddies, my buddy group just keep me sane. So we have a WhatsApp group, a number of other healthcare partners do what I do. And in the Southeast, there are quite a few of them, but we can message. And, you know, we're always that great group where you just can all laugh at each other. I think that's the most crucial thing about any job, having a group of people that will just laugh at you.
Because everyone's in the same boat in that situation, aren't they? So like you're working independently, but you're also working as part of a team. Because at the end of the day, you're feeding into a much bigger organisation.
And the strength of all of us is sharing our stories, trying to figure out, because we're there on behalf, so we stay with you throughout your journey with WPA, and we will, so, you know, I will phone you every year at your renewal, but essentially going through that paperwork and your experience of using the health insurance, we're there to sort of scrutinise some of that. If you contact me and I think, so there's stuff maybe I've noticed in the paperwork, so, you know, sometimes it's really small things and I think, but maybe that's not very clear. But all the healthcare partners are doing this. WPA head office are obviously doing this as well, scrutinising everything they have. But we can feed into that. You know, actually there was this that didn't seem to work so smoothly. Why was that? Is there anything we can do about it? And we're a not-for-profit as well, so we're always looking at ways to improve the healthcare pathway for our customers. You know, feeding that money back in so they have a much smoother experience. And yet all of us tap into that, so we will question things as again in a, you know, that healthy critical thinking to make a better service. But when all of us can chat and think, have you come across that as well? You know, maybe we should be flagging this, escalating it a little bit higher. You know, it's all for the for
the good.
Yeah, it's all for the good.
Because it's a very difficult situation today in the world, isn't it? In terms of like, I mean, I know the UK is very fortunate to have the National Health Service, and the fact that everybody has an equal opportunity pretty much to be able to use that service to get help for whatever ailment or problem they have. But as more and more people, as time goes on, obviously some people need that support more quickly, and they don't, obviously if you have to wait, I don't know, 3 months, 6 months, I mean, it's like, I mean, I know, like sort of like from, overseas, you can go sometimes and you make an appointment, you go and see something, and you have a blood test or something, and the same afternoon you get the results and you know what's going on. Whereas like in this country, you go in, you go to see the doctor, and they make an appointment, and you go and get a blood test, and then you wait 6 weeks for the result, or then they say, and now you need to have a scan. So, okay, now you get booking for the scan. Then you've got to wait 6 months for the scan, and then you go off and do that. And all these things take ages and time, and obviously it's having something. And I guess really it's a way of finding a way. And health insurance is like a complementary thing, I guess.
You can tell us a bit more, because obviously I personally had very, very different view of how this works. But for anyone who is listening or watching us and they're a bit like me and they're not actually aware, what is the health insurance?
So if you don't mind me taking a sort of step back, we are so fortunate with the NHS, and as you say, everybody's got this service. You're not feeling well, you can go and be treated, you can go and be seen and be treated. The issue is that the NHS is working so hard. All of us are living longer, therefore all of us have, because there's not many people, if you think about people there's not many people that have absolutely zero wrong with them, right? There is something, however small, everybody has something. So everybody is tapping into that NHS more and more as they get older. So demand is outstripping what they can cover. So there are waiting lists. And yes, if you don't want to wait, and of course, we sitting here on the sofa will know so many business owners, and we come across business owners and what we do all the time. So if you've got family, you've got a business to run, whatever your responsibilities are, you just might not be able to afford waiting that long. So health insurance gives you access to secondary care. So that's what it was always about. That's what WPA were always about. Essentially pennies from the many to pay out for the few, to give you that chance to go to a hospital and have your surgery, get fixed, get treated, get back to doing whatever you're doing, whether it be golf, whether it be running a business. So that's what health insurance is, getting you that access when you need it most. What's happening, though, of course, is many people, as I say, are living with various conditions. You might have chronic conditions, but health insurance really still is to get you fixed. And I think there's just a lot of confusion over what's covered and when and why. And we hate the word exclusion. So if something isn't covered, a lot of people get really, really frantic. To maybe put this in a different way, I'm probably just waffling now because I can think of so many stories. And I do become this person of like doom and gloom. But say the last week I've had some challenging conversations because, you talk to the person that's got a heart problem, and what that means in reality and what they may or may not be covered for. When you look at worst case scenario, that sounds horrible. Yet you don't necessarily get health insurance to cover you just for that one organ or for one part of the body. If it doesn't feel right, or however it feels, if it feels really emotional to know that there's a part of you that's not covered, what about the rest of you?
I think this is quite important because, yes, when we talk, I always thought, obviously, I was very wrong because I was thinking when you got health insurance, is basically it's your way, you pay and you get the services that you want. Yeah. But actually, in reality, it's not exactly that, just based on, how are you and if you have any conditions already, isn't it? And that makes me to think that maybe something we all need to think from earlier stage, from earlier. And from my personal experience, I was thinking if you start earlier when you're much more healthy, and we expect that, hopefully, let's say it's not always the case, but in general, as younger you are, as healthier you are, if you start maybe from that point, it's much more even beneficial because you will be covered on your journey in general. But on another side, with Richard, a few times we talk, doesn't matter what it is and how it is, it's always the moment that if you can afford and if you want and you feel comfortable and happy to do it, it's quite good to do it because you never know in the meantime what is behind the corner.
We never know what's around the corner. And we're healthy today and tomorrow something might,
and what I can see that at least what we discuss with you and all your help and support, once again, I can really recommend if anyone is looking for that to speak with you, because it was, unbelievable explaining all the time, especially with my questions all the time that I didn't understand the things.
But
this is what, makes you to choose you as well, to know that we are in good hands. It's good to know that for anything else that is coming, the help that you're going to get in as a product is amazing because it's giving you lots of additional things which you never thought. Hopefully nobody needs to get to that point.
Yes.
But as we have insurances for cars, houses and everything else, maybe that's our insurance.
And you hope
for
that you
ourselves.
never have to use it.
Exactly.
So some tricky conversations are about cost because, we want to feel, especially sort of the world we live in, you want to feel that you're getting value. But of course, with your health insurance, the value is your peace of mind. You hope you never have to use your health insurance.
That's
you
the
hope you never
best
have to
thing.
use the NHS. You hope you never have to worry about your health, full stop. But then, so those can be sort of tricky conversations because, of course, it's easy. Well, I say it's easy for me. I've been a customer of WPA for 15 years. My kids, you're saying about getting insurance early. My kids are covered from the day they were born, essentially. They were put straight on the policies. They're covered for anything that arises. They fall, covered.
Yeah.
And that's, we think of all these, and I can come up with horrible, we all know people living with some really horrible big things out there. I'm sorry, it's just, within our own families or whatever. But actually, some of the biggest horror stories are those people that have just fallen. You're fine today, you fall tomorrow, you're not covered. So, everything from somebody needing spinal surgery to somebody that, fell off their bike and hit their head. And then, the worry, you're not covered. You don't have that option to be able to, hopefully you're still absolutely fine. But say you're not, and say you need a second opinion or you want to use your private health for that. That's where it kind of comes into its own a little bit. Yeah. I think the thing is demand is so high. And I think we all worry, especially post-COVID, we all worry, but what if my symptoms, what if the MRI hasn't picked this up? What if something's been missed? I want to double check and I want to, well, actually the healthcare pathway is still one of the same. You still need to start with that GP referral first because they're your screening tool. And I genuinely, the NHS is amazing. Our GPs and our access to primary care is amazing. They're so overworked. So I know there's a lot of frustrations there, but through health insurance, you can get your remote GP access. And then through somebody like me, when somebody, and there's a number of healthcare partners out there that are doing, supporting their clients in the same way. You can, you go to your remote GP and you say to them, because your remote GP cannot obviously physically examine you. They cannot look in, any orifice or take samples. So they might not be able to give you an answer right then or there. But if you go to your local GP and say, my remote GP's actually told me to come along, I've actually spoken to one health professional already, your experience might be a lot better. They're going to listen to you. But it is just that demand. So there is still care pathway that you need to follow. You still do need to update WPA or your insurance company at every step of the way to keep an audit trail so they know what's going on, because only you know what's going on with your health and what the next steps might be. So there's paperwork to fill in, and again, that's where I feel happy that I can support some of my customers, because sometimes, you're not well. We're not well. I mean, if you're anything like me,
even when you're well, trust me, I look at the form you sent not long ago, and I opened the form, I read through it. I was like, no, I can't. I'm going to speak with her, because I don't know, some things are simple, but sometimes some questions
I like it with my own life admin, filling forms in with everybody else, and I'm there and I'm on it. I'm filling forms, been looking at income protection for myself, and have I done it? No, it's all sitting there though.
It's all
there. It's all ready. I will do it.
It's crazy, but that's why it's good that there are people like you who are there to help to anyone and answer any question. So how are you finding the demand in general? Are people much more looking for that option? Or with the life going a bit more expensive, people are thinking that this is a cost? I mean, which I was thinking as well. I'm absolutely honest here. Yeah. I was thinking it's cost, but then after explanation that you said it really good. The value is that peace of mind that you get. And I don't think it's anything better than that, because in case something happens.
In case,
Because it's having that ultimate care, isn't it? And the difference between feeling, because otherwise it's the stress. And if someone's poorly, I think if you're really stressed because you're not getting the support you need, it just accelerates the deterioration of health. Yeah. Because the more we worry,
you go in that
you go down a plug hole effect, and you end up other things come along at people because they're like really worried and concerned and thinking no one cares. Yeah. But the difference is actually then all of a sudden you do get the care and support and help.
And I really like it when people pick up the phone and talk to me and tell me what's going on. And if I can help and advise or even just sort of monitor things my end, then I will, and I'll do whatever I can, because it is really stressful. And I think all of us, and this is all of us, this isn't a criticism on anybody. When you're in pain, when you've got other things going on, and you don't know what's happening with your own, you're not in control of your own body. You get really anxious, and actually it sends us all a little bit crazy. So when you've got paperwork and you're trying to think of, but what doctor shall I see and where shall I go? And I don't know what to do. You can talk to somebody, and there's people there. Because I think when it all goes wrong for people is when, one, they don't understand what their policy is about. And two, when they haven't followed the process. There are people that think, well, I've got private healthcare, so I'm going to go and see this amazing doctor in London, and I'm just going to, and then they find us out. I can't get this.
We're just on Harley Street, so just having this done, and I just done this. He's got this bill of like £14,000. Like, got to just send that to you.
No. And I do say to people, sort of, tongue in cheek, you can't crash your car, go buy an Aston Martin, and expect your car insurance is going to pay for your Aston Martin.
No,
it doesn't work like that. You have to tell them first. I crashed my car, I've chipped my windscreen.
But maybe it's as well a bit of education and awareness for people how and what to, because you can hear about healthcare, obviously private insurance or whatever is good, but maybe people don't know that much in details how it works, as I'm a clear example of that. But on my question about the demand, we took you somewhere else.
And I go off on tangents all the time, so you have to rein me in. If I'm really honest, I think everybody knows that it's a good idea. Like the statistics about the NHS are out there. It's actually a no-brainer. But life's really expensive. It's really expensive at the moment, and we're always looking for ways to cut down and reduce that budget. And and that's what you're up against. And actually, health insurance isn't cheap.
No.
But healthcare is not cheap.
It's not one. That's our main, how to say it, not asset, but kind of. If we're not healthy, not well, we can do anything else.
Yeah.
If you want a Rolls Royce, you have to pay the price of the Rolls Royce.
Yeah, but
right?
it's
and
but
there's
actually,
a demand for healthcare.
There's lots of things that people do and spend money on every single day, which don't benefit their lives, but they do it all the time without thinking about it. Whether it's, I don't know,
but maybe that's where it's coming, the awareness, and much more to know about it and know the benefits and know what is coming. But that's why I ask you, because I was supposed it might be the cost of living in all this that stopped lots of people to.
And then, of course, something that we also come across is people looking to maybe reduce the benefits on their policy, to sort of make a saving. And I had this dear lady that wanted to do just that. She's a lot older, and she's retired, and actually you get older and the odds are just against you, and your premiums are horrible, because you're older and that risk of you falling unwell is so much higher. And she reduced her policy against advice, and then she did fall, and she did need spinal surgery, and she had to. It's a sort of a long story. There was a lot of work that went into this in the background. She is lovely. She's sort of, I've been messaging her. She's on holiday at the moment. I've been saying like, what's it like in Tenerife? But she contacts me all the time, which actually is great, because she was there saying, can I go to this hospital? No, because you got that out of the hospital. Do not go. Please do not go to that hospital. But the surgeon she found would only operate on her in a hospital that she didn't have a benefit for. And like I say, I spoke to the PA of this surgeon. Never do this. I can't advise that I can never do this again. WPA came in and paid 60% essentially of a claim for a benefit she didn't have, for her surgery and for her to stay in hospital for however many days she needed. People look at insurance companies and think, oh, but it's just about the money, and it's just, and of course they are, they are a business. But we do have this sort of, what can we do? How can we help? And I think we take people on a case-by-case basis. We're highly, highly regulated. So a lot of the paperwork and the loops you've got to jump through is a lot to do with that sort of thing. But I just think the value is having someone, as having a healthcare partner, help you navigate some of this stuff at the worst times. So when I say my week's been really challenging, it's because I've had some of these my most challenging conversations are with those people that are really unwell, and just trying to get
the thing is
through.
the difference it makes is the human connection, and it may be even a consultant or a surgeon. They might work with certain hospitals, but they may then say, oh, well, actually, if you go, they might even sort of say to their PA, well, actually, if that particular patient goes to this particular hospital, I can help them.
Yeah.
And because they do that kind of stuff,
they can do. And they will, and many of them will work in the NHS.
Yeah.
I think where things are getting really, and this is probably me going off on a bit of a tangent, I think doctors are amazing. They've studied so hard. They've worked so many hours, doing nights. And okay, there's the whole, doctors keep striking at the moment, and we could, it's possibly sort of too controversial for today to talk about, but actually they haven't always been recognised for the amount of work they do. GPs, the old-fashioned sort of GP that we remember was responsible for every single one of their patients 365 days of the year. Like what price do you put on that? Some health professionals and consultants these days, I think, are realising that actually I can earn a really good living from just working privately and maybe not in the NHS. But many of the best consultants still work privately and in the NHS. And if you've got somebody that's looking after you and he's maybe max out on some of your private medical benefits, you have that conversation with your consultant about what the next steps are.
Doctors and health for me is always very controversial, because, when they become doctors, that is it Hippocrates, they've got something that they need to say and learn, because they're going to help, they're going to do everything. And when you look on the stories of people who need huge amounts of money for fight with some really awful disease and illnesses and etc. If I must be honest, I see less here, but I see a lot, let's say, in Bulgaria. They're constantly, and my heart is absolutely broken, especially when they are kids. And you see how much, sometimes I'm thinking, how you put price on the people's life, and you've got these horrendous amounts, but I assume it's not only their work, it's about the drugs and everything, you know.
Some of the drugs are crazy expensive.
I just start and think, okay, but everybody should have that right to live, isn't it?
Yeah.
And it's all about, it's everybody's right. It's everybody need to have access. And next thing, people can't afford that. And you can't pay for it. And it's, I don't know where is the...
Yeah.
I never maybe will find the answer on this question. Why need to cost so much? Why, when the medicine is so much going ahead and it's all about to help people?
Yeah.
I don't know. If I ever get the answer of that, it's going to be amazing.
I guess, I mean, technology is changing so much as well, even in like, I mean...
Yeah, but if there is a drug that exists,
yeah,
if I pay, I don't know, 150,000 pounds, I'm going to get it. But if I don't pay, I'm not going to get it. Why?
It's like cancer, isn't it? I mean, if you take cancer as a good example, I guess, because like in the past, if you had some form of cancer, you would go and get chemotherapy, and chemotherapy is like this blunt instrument that gets injected into you or whatever, or a tablet or whatever, and it basically just kills all the cells, and it happens to kill the cancer cells. Whereas today, the drug companies are now working on these incredible treatments, which basically sort of target certain cells in the body, almost as if they've got some technology that just zaps to it. But not only that, it doesn't just do that, it also creates like immunity. So like an immunotherapy technology, which basically then prevents that happening anywhere else in the body, which means then you'll maybe never get that cancer again, and having those kind of treatments.
Yeah, but okay, that's the thing. Why this need to be so expensive for the people? Because what they invest maybe to do it.
The society
This
we
is
live
the
in,
thing.
the demand society.
Yes.
There's the demand for it,
Yeah,
so
it
the price goes up.
Yeah.
I mean, is that
This is what is very, I mean, it's not nothing to do with you and with that. It's just the conversation that I always had in my head.
Yes.
Why?
But it's a fascinating thing, isn't it? Because like, I suppose it's like, you know, drug companies that they put millions or billions of whatever it is to do that research. Then they patent that technology.
Yeah.
And all the time that technology is patented, it's got huge asset value to that particular company, and that goes on until they trial in areas in the world. Generally, they put those drugs into people where they're being paid. So probably it's like, maybe if I don't know, so there's no facts on this, but I imagine like if you imagine if you're in the States and you've got some mega expensive health insurance policy that you then get access to all these drugs. So if you're in the US, maybe you get access to that, but maybe the NHS or like, you know, doesn't get access to those particular drugs, although they're available, and that they're not on their list.
Yeah.
And if those drugs aren't on that list, then you don't get those drugs. And that's effectively what I'm sure happens in some ways.
It does. Everything we do through WPA is NICE approved, but there are NICE approved drugs, more advanced drugs that are NICE approved that are not readily available on the NHS that you can get through your private health insurance. So there are, not just the drugs, but some advanced technologies, and and it's all about that quality of life and sort of prognosis, and sort of looking at the NHS and how they can manage. There's just so many people, and they have to take this sort of really sort of pragmatic view on how to be able to treat everybody. Yet, of course, if you're that person or that's your family member, that's never going to be easy to
it's never going to be.
It's the hardest thing in the world.
Yeah,
it's the hardest thing. In the world.
A little bit about you. Who, during all this journey, everything you do, did you have someone who inspired you? Someone who played the role that you're like, I want to be like them, or to be like your role model or something like that? Did you have someone?
I guess it has to be my dad. He's done, he's done an amazing, he's a GP.
Okay.
Just worked really hard, was always working, but gave us everything and still would. Is always that, just, you know, one of those amazing dads that's just still there. Me and my sister would probably moan about him because, you know, if we're doing something, or, you know, you need, I don't know, a solicitor or something, my dad will be there, right, we need to get you a solicitor. And it's like, but I'm on it, Dad. You don't need to, I can find my own solicitor, it's fine. No, he's amazing how he's worked. Shocking, actually. I don't know what age he was when he came to this country, but he came over here from India when he was young, and became, I think, the youngest GP in a single owned private practice. Sorry, the terminology sort of escaping me, but he was like a sole GP. And so when I say, you know, so I am biased when I talk about the NHS and GPs.
Yeah, but you've seen it
how
from
hard
as
he
well.
works,
First,
seeing how hard he works, and he's one of those old-fashioned doctors responsible for all of his patients. I remember being on holiday somewhere, and I think I did not have in any way a hard life at all. The hard graft that he put in to give us the life that we had, you know, only came when we were sort of much older. I remember being teenagers and having our sort of first family holiday. We were really, really fortunate enough to go to Florida. And lo and behold, someone came over and said hello to him, and you could just see it on his face. It was a patient. And they were saying hello to him, and you could just see his face of like, can't quite, the name's not coming quick enough into my head. We all knew that it's someone, that the name's going to come, and then slowly the cogs, and he was like, oh, how are you?
Yeah, because he probably sees 2,000, 3,000 people
just
in a year.
imagine how many
More.
they see.
Yeah, runs a really good practice. It's really hard to hear, you know, and I get it when you're unwell and you want answers and you can't get through to your GP. Yet, if I sort of liken it to, if anyone's got kids and that club's booking page opens at 7 p.m. in the evening, like, we set an alarm.
Yes,
I need to
do.
put my club.
Yeah.
I need to put my kids into these clubs, and boom, you're 2 seconds late, all the clubs are gone. And it's a bit like that, 8 o'clock in the morning, trying to get through to your GP. It's because of the demand. And, you know, you've got 50 people phoning in to one person at the end of a phone line, and we don't want to talk to AI or an automated. So, you know, but that demand at certain times of the day is
just,
we
and, need to be,
and you can't hire someone just to work that 1 hour to man a phone line. That's also not correct. But yeah, he's run a really good practice. His knowledge is amazing, and again, growing up, would see him. I remember once on Christmas Day, he got a call out, and he actually he delivered a baby at home. And my mum was fuming.
like...
She had 2 kids at home and Christmas dinner, and we ate by ourselves.
Yeah, but this is when you are a doctor, when you are a GP, when
and
you
he came in and he was so happy, and I bet to this day he could probably tell you the name of that baby, what they weighed.
Most probably it's one of the most remembering Christmases.
Yeah, just and my mum was fuming. But it was very funny.
But that's incredible. Look how he came, he built something so good now.
Yeah. And it's still a really good practice.
You are having your lives here. And so he's the role model.
He is, yeah. And I really hope, because I think actually I'm not very well versed with, I think I'm a millennial, is that right? Gen Zs and Gen Xs or whatever they're called. But I do see a difference in the work ethic of sort of the younger generation, maybe, you know, and sort of life being too stressful. I'm not in any way saying we shouldn't take mental health. I don't like calling it mental health. We all have physical health and mental health. But anxiety and worry and all of the things we're faced with, we need to take all of that seriously, don't get me wrong. But equally, there is something called resilience and hard work. And I guess that's why he's my inspiration. Because of the dedication, the hard work. You know, he still works now and he's nearing his 80s. But he was the one that said to me, 15 years ago, we need to get private health for, the whole family needs it. And I remember saying to him, don't be silly. I'm really healthy. I don't need private healthcare. And we've got the NHS, and it's just another expense. And he just looked at me and said, "You're being an idiot. We're all getting private medical." And boom, WPA were top back then. He's the one, still. So we went with WPA, and now, here I am.
So 15 years later, I'm working for them. I love it.
So when people come to me, I do find some conversations tricky, because actually if they're there and they're thinking with the cost and it's too high, I manage my own family's policy exactly the same way, what I do for myself and my family. And, it's the same. I treat everybody the same. So
how you find time for yourself, how you recharge yourself?
Yeah, badly. That's why I said when I was childminding, it was great. I was so organised. I was cooking. Hubby would come home and he would have dinner. And sometimes I'd cook 2 things, because I think, he doesn't want to cook that. I mean, sometimes, to be fair, he might raise his eyebrow at this, because actually sometimes maybe he had a ready meal or something out the oven. These days I'm a bit like, can I, packets of crisps and cereal is a very well balanced meal. It's fortified, you've got your calcium. Is that not okay for dinner? And there was one day when my husband came in and he sort of, see the fear on his face, as he said, I don't know if we shouldn't always feed the kids cereal for dinner. I don't actually feed the kids cereal. And they said, but yesterday they said that they had cereal for dinner. Yes, because they chose not to eat what I had cooked.
So nice and easy. You are doing your thing.
I am.
Just the choices nowadays, I think,
But that's everyone's situation. I think pressure, isn't it? There are moments when you come in, you've had a long day, or you've been, and all of a sudden there's a moment, think, it's time to eat. I'm hungry. Yeah. And then it's sort of like, I need to do something quick.
Yeah.
Yeah. And it's, although,
no,
in theory,
these are excuses.
They are, but there are times. I know. I mean, we can definitely have healthy food. We can have vegetables and stuff. And even now, you sometimes think, I need to have more greens. I need to have vegetables. Yeah. And actually, you do something with it and go, actually, that was really nice. Yeah. And yet, you sort of often go, just pop in here and just get that quickly. Stick it in the microwave. Stick it in the air fryer. At least we've all been
fed, right? It's better to eat than not eat.
Yeah, absolutely.
I've got another controversial thing here, but it's like I don't. Yeah, maybe I mentioned before in the podcast, I don't know if it's not possible to go in a fast food chain and to buy like a whole meal, let's say, for, I don't know what is, £5 to £7, and to go in a shop and to buy a healthy, nice salad for £10. It's ridiculous. It's not possible that you make the healthy choices again are much more expensive. And we expect the people, everybody to be able, they can't. That's the truth. Yeah. And I know now there will be people who will be like, you can go in the shop, buy these things and do it. Yes, but when you're on the go, when you're on the road, if I need to compare the options, always the bad options are cheaper, quicker, rather than the healthier ones. Yeah. So it's very, again, getting to that point, but the choice is ours. So
it's time, isn't it? I think we all at the time sometimes, or we're not. And that's definitely, I need to get better at closing that laptop down, not doing bits. I will always end up opening it up in the evening so that the next day feels more manageable. But drop the kids off at school, walk the lovely doggy. That she's sort of become my therapist now, because actually I have to take her out for a walk.
Yeah.
So
but that's where you get your moments.
Yes, so that will be doing a walk is really lovely. Yeah. And actually, when I network a lot and one-to-ones, I try and ask people, do you fancy doing a walk instead?
That's quite good, yeah.
Instead of going and getting a coffee.
I imagine if you have 3 meetings, one after another, how much coffee
how much coffee can you drink? Okay. And I do end up going. I just don't even think about it. Just, get another coffee. I'm trying to be good, drink decaf.
But
that's a nice, really good idea.
Meeting. Why not?
Walking meeting.
Go for a walk. There's lots of lovely places to walk around. But I think it can be harder to be strict on time, because then if you've walked a little bit slower or whatever, then and you're in the middle of nowhere, you can't sort of say, right, I've got to go now.
It's still manageable, I'm pretty sure.
Manageable. Yeah. So
thank you very much for your time. Thank you for being so open and honest and share us quite interesting story, I would say. Very, how you start, where it goes, and where you are now. And as you as well look how the loop again.
Yeah, gosh. And it feels like it has all connected sort of at the end in a number of sort of different ways. Yeah, we'll see where I am.
And we can definitely see that you've got that passion and drive with what you're doing now. And once again, highly advise anyone listening us, find all the information about Nina, and she'll be more than happy to help you.
There's a number of different healthcare partners. You can go on the WPA website and find people sort of in your area close to you. We'd all, we'll all look after you. We stay with you. I think that's the key thing. Yeah.
Nina, thank you very much. So we hope everyone's enjoyed today's episode, and if you've enjoyed it, please do give us a like. We appreciate that, and please do subscribe to the channel.
And if you like to help and support our project, our journey to be able to bring more and more inspiring people, sharing stories, giving advices, please buy us a coffee on the link below. It will be very highly appreciated. Thank you, and see you next time.